This is going to be a story about transformation. And transformation stories have a couple different elements, right? They have a before and they have an after. What's often hard to pinpoint is the moment when things change. When you talk about cities and you say, what was the turning point? When did this really start? Often it's hard to literally be precise about it. But in this case, I feel like we can be. You would think that with Huntington that it would have been 2008 when the CDC comes out with this report and says that the metropolitan area has the worst rates, have it written down here, has like the...
Oh, go ahead.
The six
Just
negative...
rub it in.
It leads the country. We're starting at the bottom and we're going up from there. It leads the country in 6 negative health categories, including obesity, heart disease, and diabetes. The Associated Press jumps on that report. They write a big story about this and explore it, and they talk about 45% of adults in the 5-county area around Huntington are obese. So they have a body mass index of 30 or more. 1 in 5 have suffered heart disease, and a third of them in the last month say that they've logged 0 leisure physical activity.
The extent of leisure time was getting up and just doing some
Getting
curls.
seconds.
Yeah.
Getting
yeah.
seconds.
Yeah.
Okay, so who sees this? That is not the moment. It sounds like the moment. It's not.
Right.
A reality TV show producer, they see this, this story.
We were a forerunner. He became the president of the United States, so, you know.
So then the reality show producer gets the attention. Jamie Oliver, the chef over in the UK who's helped change the diet in schools over there, his group seizes on this and they do an episode of Food Revolution on Huntington. They come to town and they basically point a finger at the community, and that is the moment that starts to kind of divide the community in a way that you guys have been kind of rebuilding from ever since. But I want to hear, what was it about that? Really a public shaming, saying you're the fattest. The way they characterize it, it wasn't just the 5-county area. Huntington took the brunt of it. So as a city, you were labeled kind of the fattest, least healthiest city, and that is a low point.
Well, the way most of the residents within the city looked at it is they said Huntington is the most obese, most unhealthy city in the nation. Mm-hmm. But they were looking at a 5-county region. The CDC statistics were saying it was a 49% obesity rate, that there were pizzerias on every corner, more fast food shops than anything else. And there were some that were just, hell no, this isn't us. But at some point you have to quit arguing and quit pointing fingers, and there's a point where you have to acknowledge the brutal facts, but have an unending faith in your ability to prevail.
So I'm curious, I'm going to jump in here.
Sure.
What role does the city play in getting people to move beyond resisting and saying, oh, all these outsiders are coming in and labeling us, and that they don't know us. They don't know what it's like to live here. What role was the city playing to begin the process of turning around, and what role were citizens?
Well, when it first happened, we've been through 2 mayors, and then I came in. So the city was doing some things, but it wasn't doing an awful lot. Mm-hmm. It principally was the community started to rise up. Mm-hmm. The hospitals, the local university, individuals within the community, and the tragedy, interestingly enough, the tragedy years before of September 11th, there was a young physician who was killed in one of the crashes of September 11th. Mm-hmm. He worked for the Surgeon General, and he worked on childhood obesity. So as a result of that, his family stepped forward, and there were some city and state leaders said, well, let's build a path. Mm-hmm. And we call it the Paul Ambrose Trail for Health, PATH, Paul Ambrose Trail for Health. 26 miles of trails around the city started during that time. Mm-hmm. Then the city got active with bike paths. We have Sharrows and such. A lot of people like to run, so we decided let's do what we can to start encouraging running in Huntington. Huntington, then we were having so many road races in the community on the weekends. Runner's World magazine came back not the most obese city around, it said Huntington, West Virginia. So these things started picking up, and after a little bit, you started to see that folks were beginning to square their shoulders. But we still had major issues. And when Jamie Oliver came into town, honest to goodness, there were some things that, as we look at it, we had some lasting effect. But geez, oh Pete, I mean.
See, this is the side of reality shows we never get. It's like the victim
well,
of a reality show hit job.
My wife even went down to one of the line dance things. I mean, it's like, oh, come on, Mary, let's not feed the monster.
Right.
But
okay, but as a city, you come in, the monster has come and gone, and it's left a bruise, a psychological bruise.
It left a big, smelly thing on the street.
Right.
It was ugly, but he had Jamie Oliver's Kitchen. It's still present. Teaching
Jamie Oliver's Kitchen, which this was a storefront in the heart of downtown in Huntington, that he turned into what? It was like an educational kitchen for kids and families?
The hospital took it over, continued it for a number of years to have healthy cooking classes that they would teach. The university has since taken it over. The university's own nutrition programs have moved into the downtown area. So in that regard, we give enough time, we've been able to turn lemons into lemonade, if you will, without sugar.
Yeah.
But what we've been
good distinction.
Got to be healthy here.
All right, so I want to unpack some of that, because in a way it's like you jumped ahead to all these different programs now in place, but they don't start as fully mature programs. They start as like kind of crazy ideas. I got an idea, I got a notion, I want to start something here. How did the city start to work with citizens to make these ideas reality, to actually there were some people that came together and established a program they called Create Huntington. The idea that they would come together with ideas, and nobody could say anything negative about the idea. People were free to be able to say whatever was on their mind, and if it goes out there, it either stands on its own legs or it falls. There were some people that were saying, let's bring a Whole Foods into Huntington. Who doesn't want a Whole Foods? I was going to say, I love Whole Foods being brought out. That's the answer.
But our demographic doesn't meet that.
Right.
Our demographic doesn't meet it. But this is the power. This is the power of Huntington. There were some women in this one group, and in Create Huntington, one specific college senior for her capstone project said, "Why don't we create our own?"
At Marshall, the local college University there in Huntington,
And she said, why don't we create our own? And that they have, every Thursday evening, they have what they call a chat and chew, where you would come together, you'd have a few cocktails, you have something to eat, and then just break out into groups, and then just talk about whatever comes to mind. This lady threw her idea out, came in and elicited the support of them, and Wild Ramp rose. In essence, what they chose to do was go to 250 farmers, or to farmers in a 250-mile radius, and offer to help them be able to sell their produce. And they have new produce coming in every week. They went into this small area and outgrew it. The city had an opportunity with another end of town where we had a market building that had only been used for senior lunches, and had been doing that for about 10 to 15 years, and we made an offer to them. Said, come in, we'll rent you the building for $1 a year. You take care of all of your expenses, move down to this area. This area is a traditional antique district, but it was also in significant decline. I was looking for a way to be able to draw have an anchor to draw new people into the area. Let's face it, the folks that were coming down for the antiques and the folks that were going to the farmers market and to the Wild Ramp,
the seniors,
they were totally different. When we brought Wild Ramp in, it brought a whole new different group, and each year they have been able to increase their productivity and their profits each year, and now they've been in business. I've been in office for 6 years, for 7 years now.
Yeah, it's like over $1 million,
Yeah.
I think, has been returned to those farmers within that area.
Yeah.
Like over 125 farmers, I think is right.
And it also helps to encourage farming as a business as well, from the economic aspect. We have some young entrepreneurs who are doing, social entrepreneurs, starting a business they call the Coalfield Development Authority, where they were able to train out-of-work coal miners to be able to do other things. They're beginning, they have been trained for solar panel installation, but also how to start farming as a vocation, not just an avocation. And Wild Ramp is right in this. So you start to see, as each of you have shown in each of your presentations, there are linkages that occur. There's no one thing that is by itself. They're all linked together.
So how do you came from the banking industry, right? You were
Yeah.
in investing. I'm curious, what did you bring from that world that applied to city government in a way that helped connect with some of those citizen ideas and projects?
Just maybe 3 things. In business, we don't say no. If somebody comes in, we don't automatically say yes, but maybe here's another idea. So when somebody came in to do business with the city, the fallacy is you can't do business with the city. So we created
Why? Why can't you do business with the city?
Well, they would come in and somebody would ask for something. They'd be given a list of telephone numbers and good luck, pat on the back, and then they're out the door. We needed a business services advocate, one person who they would deal with. They would come walking in the door. That person would take them by the hand and lead them through the other operations.
Like an ambassador for these ideas.
Yeah, an advocate, just a pure out-and-out advocate. What we also started seeing within the city is that we just needed to be able to show that that we would have one cost for a permit. So you come in and it has one cost. You don't have this big big list of, at this it costs this much, this permit costs this much, this license costs this much. You have to be able to show that it's easy to be able to do business in the city.
Well, I was going to say a lot of these ideas, they're so fragile in their early stages that you just squash them with bureaucracy when you start adding like application process with all these different layers and everything. So I find what's also interesting about this does become a personal transformation story as well, because we're talking about a city that had this really high obesity rate, and we can get to what the number is now, but you actually brought a prop with us today that also shows the personal transformation that you have undergone. And I want to first off, please show us the jacket and tell us, what is this jacket? What's the story here? What does it represent?
There were 2 Steves. There was one big Steve. Let's really see what it looks like. Over top of this, I went on campus at Marshall University. Here we go. See?
There's your before. I told you were going to get a before and after. There's one right there, yeah.
Yeah, I went, Marshall University is on in town, and every month I go in to meet with the students, and faculty will come by. When I was campaigning, when I would go by there and campaign, I thought, well, if I'm going to be worth my salt, I have to keep coming back. Well, on one of my coffees with the mayor, over at the side, they were doing some blood sugar tests. So they came running over and said, "Mayor, come on over here." And Chuck and I had absolutely horrid eating habits. I wouldn't eat breakfast. Sometimes I might hit lunch. And then by the time I get home in the evening, it all would come.
Yeah.
And they came over and they pricked my finger and got a little thing of blood. And honest to goodness, the lady's eyes got big and looked over and pulled the doctor over. And they looked at that and he said, "Did you just eat?" I said, "No, I haven't. I haven't eaten yet today." He said, "You have to go to your doctor." my blood sugar at that point was about 220 or 230, something like that. And long story short, he just kept coming back at me. And finally, he said, this physician said to me in a doctor's visit, he said, Steve, if you don't lose weight down to your playing weight, I played football in college. And he said, if you don't get down to your playing weight, I'm going to have to put you on the needle. That scared me. Mm-hmm. And it became real personal.
Yeah.
Because the mayors and the other elected officials will understand this. This is the best job in the world. What I'm doing, I've had success in business, success through my life, but I've never, ever done anything that's more gratifying. Wouldn't you agree? And I thought, I've worked to finally be able to do this that I know that I'm called to do, mm-hmm. and health might keep me from being able to do it. We can't do this. And frankly, that's when I came to understand how this works and how we communicate to the community. Mm-hmm. What's important to them. Mm-hmm. So we started doing some things.
Well, and I find two things jump out at me. Thank you for sharing that story, by the way, because that is really moving, and how important it is to you, because I know you lived there since you were 16 years old when you moved there, so I know this
I
deep
lost
roots in the community.
65 pounds. So,
yeah, 65 pounds. Okay, so did you think about what you literally start to, you're representing the change in the community yourself. Like, did it take on that double meaning for you at all?
No.
That's just the way it looks from the outside.
No, well, no. I knew that I needed to be doing something, but had known for a couple of years before that I needed to do something because, frankly, I thought, all right, I can carry the weight. Mm-hmm. And I look at pictures now and go, oh, good heavens. Yeah, I carried it all right.
All right, so then you also started these walks.
Yeah.
Tell us about the walks in which you're seeing different parts of the community. So I'm curious why that was important and the impact that it had, and you're interacting with citizens on these walks.
We have 11 members on the city council, 2 at large, 9 council districts. So I would go to each council member and say, let's go for a walk in your neighborhood, and we would send the word out to everybody that the mayor and council member, and it ended up actually being City Hall would go and descend upon the neighborhood, and we would go walking through the neighborhood. The idea is let's get out, try to encourage the students that lived in the area, invite them to come out, and if they come out, they'll bring their families out with them. But previous mayors would have open houses where people could come in without appointments and come into the mayor's office and talk about something. And I thought, well, why don't we just take it to them? We'll be able to walk throughout the neighborhood, and they'll be able to say, see that dilapidated house, see that pothole, see this sidewalk. And there was one instance that just absolutely broke my heart because we were going through the neighborhood. It was a distressed neighborhood, and all these people came out to be with me. And a few people in wheelchairs, but the sidewalks were in such bad shape that they had to go down through the middle of the street.
Wow. In
the wheelchair. But as we were going on this very same trip, we were going down the street, and some friends said this one lady wanted to see me, and she had just turned 100 years old the summer before. And I came in and did a proclamation, had a big party, and some of her grandchildren were friends of mine. And I came in, and there she was, waiting on the front porch with a pitcher of lemonade. There she was in her little sweater and her pearls and waiting on the mayor to come up and have lemonade with her. Wow. That. We would see people that would come and just wait for us to be able to point at things. And it was amazing as you watch individuals as they would walk with us, they get into a rhythm. We'd walk along, somebody would come up and they'd point out just what was on their mind, and then they would fall back, and then somebody else would settle in. And we've now had 54 walks over the last couple of years in the city, and we have more that we're scheduling this summer.
I want to get to questions some in the audience in just a minute, but last one here for Steve. First off, I have to kind of finish, I got to provide a little closure to my story before, in that the obesity rate is now dropped, the metro area's obesity rate has dropped to 35%. Yeah. So from 49% in 2008, that's 10 years.
35%, yeah. So that's 14 points that it's dropped. We live in a market area of over 360,000 people, which means over 42,000 people are now not considered obese that were considered before.
Right.
That's a good thing.
On that note, I want to open it up to the audience for your questions. And we have mics obviously floating around the room right here.
Hi, I'm Natalie with the City of Newark Office of Sustainability. There were a bunch of things about your talk that touched on sort of different ways in which a primary concern of public health touched on economic development, on community engagement, on even personal transformation and sort of empowerment. I'm curious if you feel like, what maybe was the most surprising element for you in terms of how a kind of keystone issue could then touch all of these other pieces. Health in particular is so interrelated to so many other pieces.
I firmly believe if you name it, you can own it. We named it, or it was named for us. But with that, as we named it, we started talking to one another about it. It was not something that you would just kind of push aside. We actively talked about it. And we've learned when you collaborate, it will lead to partnerships. And that's what started happening. And it wasn't something that we had to come up with an idea as to how to do something, is that people began to bring us ideas. There's a Walk to the Moon initiative that's occurring. Some people came, some foundation help, some local businesses, the hospitals, the medical schools are coming in, and we have trackers. Well, I've got my cufflinks on, but I've got a tracker on here where we're watching our steps, and then we're planning on making sure that we walk to the moon by this fall. They came to me. It wasn't something that we said, well, we'll come up with a big idea. They came to me with the idea. So collaboration, start talking about it, leads to partnerships.
And then in terms of investment, like, hasn't there been significant investment in downtown and compared to like 10 years ago when it was more of a ghost town?
You could have come into downtown Huntington 10 years ago and thrown a rock and not hit anybody. Now our downtown is the most dynamic downtown in a 100-mile radius without question. Huntington got named with all of this in a competition of 352 small communities around the country that's been sponsored by Frontier Communications. April 19th, a year ago, we had to build an economic revitalization plan. Huntington won that and won a prize of $3 million and was named America's Best Community. Those are the types of things that you can do when you just believe in yourself and make no little plans. They have no magic to stir men's blood.
Well put. Yes, right here.
Good afternoon. Congratulations, Mayor and Huntington. My name is Marcia Goodwin. I'm from Orlando, and I'm the Chief Service Officer there. I was curious as to how you're measuring the results. I love the 14% reduction in obesity. How are you measuring that, and how are your citizens reporting that?
The measurement, specifically within City Hall, is that we've started changing things within our healthcare plan to encourage wellness within the community, but we've also been able to reduce our healthcare costs by $2 million per year. We have a $50 million a year budget. We've been able to start to see the changes on that. One of the other things that we really haven't had time and would not have time to go into, the opioid epidemic has hit our community extremely hard. Where we've been able to get everybody involved in that, in the last 6 months, our overdoses have decreased by 67%. We're not seeing that anywhere in the country. April, a year ago, there were 172 overdoses in our community. Last month, there were 62 overdoses in the community. So what we're seeing is that everybody has to take an assignment. Everybody has to take ownership. And as we start to look and measure as to what we're doing, what we're simply asking is that, what do you want? What are you willing to do? And we're encouraging everyone, and I've said it several times, take ownership of the problem. You name it, you can own it.
I think it actually comes back. I'm going to end on this note that it seems to come back and echo what we've been hearing in these other sessions about. You have to decide what kind of community you want, what kind of city you want this to be.
Well, if you look at the word decide, it comes from the Greek kaidir, and day means from. There's a point where you have to cut from that which you have been doing before in order to be able to move forward. We figured that out, and each of your communities have figured that out as well.
All right. We're going to end on the Greek wisdom. Thank you. Appreciate it, Steve.
From West Virginia. Yeah.